Hello, my name is Tricia Kuhn. I am a student with Grand Canyon University in HLT 317 with Professor Samantha Deck. This video will cover ethical issues in research surrounding communication. The first information that we will be covering is the principles of scientific communication. Communication in science should have clarity, accuracy, simplicity, and understandability. The topic should be made clear when effectively communicating, and the information should be presented accurately. If the data is not accurate, the communication will not be reliable. When getting ready to perform research, it is best to assemble an interdisciplinary group to better assess complex issues. When we are communicating, we are recounting a story or important information that needs to be addressed. We should also make the message individual, meaning that we should know the audience and how the information will be presented to the audience. The topic of our work will be targeted toward a certain group of people depending on our research and the topic of study. Another important part of communication is speaking with the audience instead of to them. Sharing information that patients or medical staff can relate to will help them make connections to the communication and keep their interest in the study. We also need to keep in mind to be human. The people we are communicating with may not always be medical professionals or doctors or scientists. So we need to remember to speak in a language that they will understand so they can utilize the information. When considering ethics, we should remember the principles of ethics, which are beneficence, non-malfeasance, respect for autonomy, and justice. Beneficence in medical research means that the researchers have the welfare of the patient in mind when performing research. Non-malfeasance means not to cause harm to a patient, which is an important part of research and the medical field. We should always focus on benefiting patients, and causing harm to a patient is against what the medical field stands for. Respect for autonomy is meant for us as medical professionals to respect the wishes of the patient. Justice is another ethics principle that we should represent as fairness to patients in research. An important part of medical research is the Institutional Review Board, or IRB, which regulates research and checks to make sure the research is ethical. It is also important for the IRB to make sure that the procedures will not harm the patients. This includes informed consent, which is a type of consent given by the patient when a patient has been given information on the research or study they were asked to participate in and have been checked for understanding. Then they can make an informed decision on the participation or the trial. When it comes to communication and ethics in research, we should focus on privacy, anonymity, and confidentiality. Anonymity in research refers to relaying the data collection in such a way that it cannot be traced to a specific person. This way, the participant of the trial can remain anonymous. Researchers should not keep respondent names when data questionnaires are returned to help with anonymity. Confidentiality is important because you can attach certain information to another researcher, but you can keep the information from the public record. This can be important when anonymity cannot be ensured. The data can only be released if the data cannot be traced to a certain individual and will ensure the patient's confidentiality. Privacy should be considered when conducting research because we learn a lot about a patient when we are conducting research. We should only use data that is relevant to the research to protect the patient's privacy. Communication is a part of research and everyday medical care. When communicating with patients, we should remember that we need to speak in a language that they understand. There may be cultural differences and language barriers when it comes to communicating with patients. If there is a language barrier, we should consider using a translator, or if a patient's family member can help translate, we should use this avenue. Important information about treatments and plans and diagnoses are being relayed, and we need to check for understanding from the patient so they can make informed decisions about their treatments and medical care. When we relay this information, we need to check for understanding by asking the patient questions or having them relay important parts of the information. Having a patient's family member can be important support group for the patient, and they can also help to understand the situation and possibly help them make decisions on their treatment or care. When documenting research, we should have our topic clearly stated, and we should have a strong thesis that will set the tone of our paper. The language should be simple and rely on the data relevant to the study. The data should be accurate and should be able to be checked. If the data is not accurate, then again, the study is not reliable or dependable. The language should be easy to understand for the target audience. In conclusion, we should keep the principles of ethics and communication in mind when we are conducting a study or research trial. We should make sure the study is safe for participants and that their confidentiality and privacy is considered and practiced in the study. Communication should also be clear when talking to patients and their families, and understanding should be checked. We need to know that our patients understand what is going on, and with their treatments, they can give us informed consent. All of these principles and ethics should be taken into consideration when conducting research, communicating with patients or other healthcare professionals, and when we are publishing findings to ensure that it is done with the audience and the patients in mind. Thank you.